I can see people coming in. We'll just wait a minute or so if we don't mind. Okay, we might get underway. Good morning, everybody. My name's Leanne Wells. I'm the Chief Executive Officer of the Consumers Health Forum of Australia. Welcome to this CHF Talks webinar on the National Medicine Policy Review. Very topical, of great interest to consumers, and very topical this week. Medicines Australia had a webinar on this very topic earlier in the week, and it was also a topic of discussion at yesterday's Health Technology Assessment Making Connections Symposium organised by the HTA Consumer Consultative Committee. The audio will be available. There's a question in the chat box already. We are recording this webinar, so it will be available after the event. Can I begin by paying my respects to the traditional custodians of the land we meet on today collectively, and pay my respects to their elders past, present and emerging. I'm on Ngunnawal land here in Canberra. So now to introduce our speakers. We're joined by Professor Michael Kidd, a face returning to our CHF Talks webinar series, and a face that'll be known to many of you, Deputy Chief Medical Officer in the Department of Health and Chair of the National Medicine Policy Review. We're joined by Jan Donovan, the Consumer Reviewer on the review panel and also a CHF Board Director. And we're also joined by Liz De Soma, CEO of Medicines Australia, an advocate for the review's initiation. Liz is not a panellist, she's not a reviewer, but certainly someone who can bring an industry perspective to the topic. And as I said, Medicines Australia were a great advocate for the review happening in the first place. So a panel eminently qualified to talk to you about the review and future directions in medicine policy. You would have received, or you would have seen, the consultation paper, discussion paper circulated by the department, and we circulated that to all registrants today prior to this webinar. If you haven't seen it, it's available on the department's Citizen Space Consultation Hub. So we'll be focusing on that today. And as reviewers, Michael and Jan will be stressing the sorts of issues they are wanting to explore in the consultation that's currently open. And if you've got thoughts on some of the issues canvassed in that consultation paper, this is your opportunity, along with many others, to put some comments and reactions into the chat as we go along through the course of the conversation today. We'll be certainly logging those and following up on those in framing our CHF submission to the review. We're hosting this today as a primer to a consultation session we're offering CHF members on the 29th of September. And we have Joe Root, our National Policy Director, and Penelope Bergen, our QUM Policy Lead, leading that piece of work, and they are listening in today. So just a few quick opening remarks from CHF about the review. It's certainly a review that we've welcomed. It's been over 20 years since the National Medicines Policy was first put in place. Much of the impetus, well, there was many drivers, I think, but much of the impetus for the review came from the realisation that technical innovation has introduced new treatments that blur the lines between medicines and devices and between prevention and treatment in a way that the existing policy those many years ago could not imagine. We want a health system that treats the whole person. So there may be value in looking at broadening the scope, and this is one of the questions to be examined, I guess, by the review, value in broadening the scope of the NMP to include other health technologies. Having a national medicines policy that includes room for adaptation and progress is really vital for ensuring optimal health outcomes for consumers. But medicines and medicines policy, it's a really complex issue. There's much about the objectives and the high-level principles in the current policy that have stood the test of time. Their strengths we wouldn't want lost. But we do need, and I think it's pretty unanimous agreement around this, that we do need an up-to-the-minute and forward-looking policy that anticipates future horizons and remains agile. And that's as much about the practicalities of implementation as it is about policy. So just as important a change in the last 22 years as some of those technological advancements has been changing consumer behaviours. Many people want to know more about the treatment options they're being offered. They want to know more about how they can be part of a shared decision-making process. And we've also seen a shift in the role of consumers in participating in decision-making at the highest level about what treatments are offered and subsidised. The Making Connections Symposium yesterday that I referenced earlier certainly highlighted that movement. So we really welcome the move to make the National Medicines Policy more consumer-centric, not just in its development, but in its implementation. There's a need, and there's a need really to also, and Jan drew this out yesterday in her presentation to the Health Technology Assessment Committee Symposium, not everyone would have seen, but the real importance of equipping consumers with competency and skill in health literacy is an important consideration as well. So all these changes and advances for consumers arguably mean that the whole web, as I said, the policy is the pinnacle, but the whole web of the systems and the policies and the guidelines and legislation that sit with and around the policy all need updating and rethinking, arguably, with the understanding of how people are currently and should be in the future accessing medicines. There's lots of things in the discussion paper that we welcome, the emphasis on partnerships, the emphasis on stewardship, as I said before, and a critical issue also is how do we measure success? And I'm sure we'll get to that question and that topic through the course of the webinar today. So look, on that note, a few introductory remarks from CHF, lots and lots of issues to canvass in our submission to the review, lots and lots of issues canvassed in the discussion paper that I mentioned. So the format for today is I'll be asking Michael, Jan and Liz in that order to spend 10 minutes or so, 15 to 10 minutes each, really giving their perspectives on the review. Michael obviously is the chair and the person leading this process, so perspectives from the government, Jan as the consumer reviewer, her perspectives as a consumer reviewer, and Liz, your thoughts and perspectives and insights from industry. Then we'll go into Q&A and we'll be running through to about 12:15. So comments in the chat box, specific questions to the panelists in the Q&A box, please. We are recording this, so we'll make it available afterwards as well. So on that note, welcome, Michael. Thanks for your time. Over to you.
Take myself off mute, of course. Thank you very much, Leanne, for the introduction, and thank you to everybody for the opportunity to speak with you about the review of the National Medicines Policy today. Jan and I are really pleased to be virtually able to meet with you on behalf of the other members of the review committee. And we do look forward to your questions after the presentation. I have to say though that in any answers, I don't want to be preempting what may come forward in the consultation process, but the sort of questions which people put are actually going to be really helpful in helping us to focus our work over the next few months. So I hope that most of you have had an opportunity to at least glance at the discussion paper and the terms of reference. The discussion paper was released on the 30th of August, and the aim of it is to help you to make your contributions to the consultations around the review. As Leanne has said, the review is being led by an expert advisory committee, and the membership has been established by the Minister for Health, the Honourable Greg Hunt MP, and it brings together expertise in medicines policy, in clinical practice, in consumer engagement, and in the pharmaceutical industry. And the members, as well as Jan and myself, include Professor Lloyd Sansom, who many of you will know well, David Hurd, who's a very respected figure in the industry, and Sarah Deneen Griffin, who is a young leader in pharmacy, but brings together, brings into the committee the voice of the next generation of people who are going to be implementing this review over the years ahead. The National Medicines Policy is a principles-based, high-level framework, And it outlines shared objectives, as Leanne has described, and the importance of a partnership-based approach to medicines in our country. It doesn't describe individual programs. It doesn't describe the various steps to operationalize those objectives. So it's a high-level set of principles. And it therefore follows that the focus of our review, and you'll see this in the terms of reference, is on the high-level policy framework rather than reviewing individual activities or programs. So we produced the discussion paper to provide some context, and I'm going to just go through each of the 6 terms of reference and the consultation process. And Jan is going to highlight in a lot more detail the importance of the revised policy in capturing the diversity of consumers and their needs in the work that we're doing. So the first term of reference, we want to hear from you as to whether the 4 objectives in the policy should be modified or whether there are additional objectives which should be included. So the 4 objectives that we have in the National Medicines Policy are firstly, timely access to the medicines that the people of Australia need at a cost that individuals and the community can afford. Secondly, that our medicines meet appropriate standards of quality, safety, and efficacy. Thirdly, a focus on the quality use of medicines. And fourthly, maintaining a responsible and viable medicines industry in Australia. Drawing on the feedback of the last time we had a stakeholder forum, which was back in January of 2020, possibly the last time many of us were able to get together in a room with people from across Australia. We're interested in hearing whether the policy should include a set of overarching principles as well as these objectives. And these principles, we feel, would be able to then guide us in the planning and design and implementation of future programs and initiatives in order to allow us to meet those 4 objectives. And we've suggested a number of principles in the discussion paper, principles of equity, of being consumer-centred in our approach, of continuing the partnership-based approach to the policy, of accountability and transparency, and also of stewardship. But our question to you is whether those proposed principles are appropriate. Is there anything missing or needing to change? And again, whether those initial 4 objectives need to be further modified. So we're very interested in your views. The next 2 terms of reference, 2 and 3, are closely related. The review has been tasked with considering whether the policy needs to be expanded to include not just medicines, but medical devices and vaccines. And we've also been asked to consider the remarkable advances in medical research which have taken place over the past 20 years and the new technologies which are coming into place to support new approaches to the prevention of disease, early detection, treatment, management, and recovery. So the questions we put are whether the policy should try to capture the breadth of technological developments and their implications for health technology assessment. For example, how do we respond to the blurring of the lines between prevention and treatment, medicines and devices, to name a few? And we've highlighted some of these developments in the discussion paper. The discussion paper also talks about the greater recognition of the importance of health literacy and the significance of new forms of communication, such as apps and social media, in how medicines are being prescribed and used. And I think over the last 18 months, as we've been responding to the COVID-19 pandemic and the disruption in our lives, 2 very important things have come forward. The first is that we now have a population which knows a lot more about epidemiology, public health, vaccines, and also wishes to have a voice in many of these areas as well. So health literacy has certainly grown in some areas over the last 18 months. And secondly, the issue of new forms of communication. 18 months ago, I don't think many of us thought that we'd be spending a lot of our time doing meetings like this. We were able to bring together people virtually from across the country in this format. And we've also seen, of course, the introduction of whole of population telehealth. We've seen prescribing, dispensing being available, a whole lot of new innovations which have come into play, which are going to have an impact on medicines in the years ahead. There are other big questions, and I'm sure there'll be a lot of different perspectives to be considered, and we welcome your perspectives and your advice on these different areas and how other changes also need to be incorporated and considered in these high-level principles in our national medicines policy. The next term of reference, and I know Jan is going to talk about this at great length, so I won't, is just emphasising the fundamental role of the consumer in achieving our objectives under the policy. The current policy does recognise the importance of consumers, but it doesn't really acknowledge the diversity of consumers and their specific needs. It has more of a passive approach to consumer engagement, and we'd like to move that ahead. And again, I think during the pandemic, we've seen how important it is to understand the diversity of consumers that we have in Australia as we develop healthcare policies to best meet the needs of everybody. So there are needs for the individual, there are needs for priority populations, and again, we want to hear from you. Again, the pandemic has underscored for us what happens when some groups of consumers remain less visible than others in our national responses, and we need to learn these lessons as well. The fifth term of reference, we've been asked to identify options to improve the governance, communications, implementation and evaluation of the national medicine policy. And this is of particular interest to this today's meeting because consumer engagement with medicines and health technology assessment processes have certainly strengthened over time. And there are a couple of key questions that we've asked in the discussion paper, which include what opportunities are there to strengthen governance arrangements for the national medicines policy? What should these be and why? And I'm sure that many of you will have views on that because, again, the consumer voice is essential in governance. And how can communication about the national medicines policy be enhanced and improved? And what sort of communication mechanisms do we need to be using? The final term of reference is to consider how to strengthen the partnership approach, which has been fundamental to the national medicines policy over the last 20 years. And in particular, we want to look at how greater accountability can be built into the policy framework and what principles do we need to highlight to ensure that conflicts of interest are managed and managed appropriately. And again, our thinking on conflicts of interest has changed over the past 20 years in lots of good ways, and we want to make sure that that is captured in the review, but also we want to be thinking over the coming years about how things might develop even further. So again, we welcome your viewpoints. So they're the terms of reference. The consultation process, we've adopted a number of ways of trying to capture the diversity of views from stakeholders and consumers. And we will be consulting with people in a number of ways. We have the call for public submissions in response to the discussion paper. And I invite you to put forward a submission, even if it's only a couple of paragraphs addressing one of the terms of reference, it's still going to be helpful. So have a look through, and if there are things that you feel we need to know about, let us know about them. It may help to be quite brief in your responses, so don't feel that you have to write pages and pages to put in a response. It can just be half a page or 1 page with the things which you feel are particularly important for the committee to know. If you'd like to put in pages and pages, you're most welcome to do that as well. But we want to get as many people feeling that they can contribute to the consultation as possible. We'll also be having a number of one-on-one interviews with key peak organisations like the Consumer Health Forum, so that the members of the review committee can hear from those peak organisations, but also interrogate the members of the organisations on what you really think is important and needs to be in the submissions. And we'll be having some virtual stakeholder forums towards the end of the year. And in these forums, we'll be bringing together groups of people who represent consumers, prescribers, dispensers, manufacturers, a range of people coming together, and hope to try and bounce ideas of people from different perspectives, because sometimes we think in our own group, and it can be very helpful to actually listen to what others have to say and then build on that as well. The call for written submissions is open until the 8th of October. And we hope that that gives you time to read the document, jot down some of your ideas, and send your ideas through to us. But I encourage everybody who's on the line to consider making a submission. I might leave it there, Leanne, and let you pass on to Jan.
Thanks very much, Michael, and also acknowledging the comprehensive and sort of multifaceted consultation strategy that the panel's undertaking. It's great. You've got obviously multiple channels and multiple ways of getting stakeholder views, which is great. Well, over to you, Jan. No further ado. The consumer reviewer, what a big hat you're wearing. Over to you for some perspectives from you.
Okay, thank you, Leanne, and thanks very much, Michael, and thank you for the opportunity to discuss the review with you, and thank you to all of you out there in the ether watching this for taking such a big interest in the National Medicines Policy Review. For us, the voice of consumers and the experiences of consumers are central to the review. As Michael has said, terms of reference 4 in the discussion paper requires that we address the central role of consumers, and most important, to see whether or not that we can capture the diversity of consumers' needs and expectations. We know we live in a very diverse society, but how can we, through the National Medicines Policy, ensure we hear those diverse voices? The consultation process has also been designed to engage, as Michael said, the cross-section of consumer groups so that we can hopefully pick up some of those voices that we don't hear often. In addition, the analysis of the written submissions that Michael's just encouraged you to do will provide us with much more information, and the review, as Michael said, will also be organising virtual group discussions with consumer representatives to gain a more in-depth understanding of your perspectives. So this is all, very important. Consumers are more informed, and we've been greatly assisted by the pandemic. I mean, it's one positive that's come out of it is that we know a lot more about vaccines than we used to, and we know a lot more about how medicines are supplied than we used to. So hopefully all of what we've learnt over the last 2 years means that we can speak up and we can participate more in decision making about our care, and also participate, and we want to, in broader health policy. So while the current National Medicines Policy does emphasise the central role of consumers in achieving its objectives, There's no acknowledgement in the current national medicines policy of how diverse our consumer community is and specific needs for that diverse community. So, for example, we understand the challenges vulnerable people often have with multiple chronic illnesses. They are often prescribed multiple medications, many more medications. I worked a lot with older people, and now they used to be on 5 to 10, now they're on 10 to 15 or 20. So juggling this, and also for those with life-threatening illness who may not, due to their location, be able to easily access treatments. That just flags some of the diverse communities we're talking about. In addition to these issues, the prevalence of polypharmacy remains a challenge. And as I said, people now are prescribed 15 or more medications, which has a range of risks for them. So preventable harm from medicines is a critical consumer issue. A report by the Pharmaceutical Society of Australia recently outlined that more than 250,000 Australians are admitted to hospital each year because of the problems related to their medicines, at a cost in excess of 1.5 billion annually to the health system. Discussions at the stakeholder forum, and this was a big stakeholder forum that I was very fortunate to attend, and there were lots of consumer representatives there. As Michael pointed out, we just got it in before all the lockdown started, so it was very fortuitous, that forum. So that forum really emphasised the need for patient-centric focus with the national medicines policy to empower consumers to make informed choices about the quality use of medicines. And this sentiment was widely held. Every stakeholder group acknowledged that. The strengthening of the consumer voice and input into the policy was raised as an important principle, and that's why it's been captured in those draft proposed principles in the consultation document. The refreshed policy will need to explicitly capture the cultural, geographical, socioeconomic diversity and disadvantage of many of our consumers. And we've seen that, as Michael's rightly pointed out, in the pandemic. We've seen the cultural diversity and how the pandemic's affected particular groups more than others because of a range of issues. So that consumer-centred principle is going to be a very important guiding value for the future document. So it includes the adoption of a consumer-centred approach, which is where we want to hear from you. What does that mean for you, that consumer-centred approach? So for us, it would mean, well, my vision and the group's vision is that it would mean that consumers are informed and engaged and empowered to participate in their medicines and in the medicines policy, recognising that it's a collaborative effort. Collaboration is always much easier when the objectives are clearly defined and agreed. It is also much easier when those involved share a common set of principles and values. And I love Sarah's analogy here. The National Medicines Policy works like a compass. Each participant, each consumer, each stakeholder, no matter where you are in the medicines policy landscape, can turn to and quickly see true north and align our activities and programs. So as Michael mentioned, health literacy has been discussed, I think, in terms of reference 3 and 4. And it's another area of the medicines policy that needs to be more explicitly addressed in the revised policy framework. Terms of reference 3 seeks to assess the national medicines policy utility in the context of rapidly evolving treatment options, population changes, interconnected relationships, and system-wide capacities. Feedback in the stakeholder forum, the one that I was talking about earlier, that was in January 2020, there was a large strong consumer contingent there, and they raised, as well as the other stakeholders, raised the importance of consumer health literacy and understanding and implementing quality use of medicines. And that's because of the more complex treatment options. More effort now is needed to ensure that consumers participate as partners in their treatments and care and are able to act on treatment advice and information. We know consumers with low health literacy are more likely to have worse health outcomes overall and adverse health behaviours. They tend to have higher hospital readmission rates, and I certainly saw this with my work with older people. And sometimes, sometimes the information they get is confusing. So they often have poorer understanding of medication instructions and reluctant to ask questions to ensure that they know how to take a medicine. So the pandemic is also highlighting the importance of health literacy. The rollout of COVID-19 vaccines has made Australians and people around the world more aware of how medicines and vaccines are made available through our health system. This includes weighing up the benefits and risks when medicines are provided and recognising that medicines and vaccines, even the best of them, can have side effects for some people. These are important conversations relevant to all of us who use medicines and vaccines. So the question posed in terms of reference 3 and 4 for you to consider include: how can the national medicines policy be more consumer-centred? And how can the policy engage with consumers in order to be strengthened? Is anything missing, and what needs to change? Also, how can the medicines policy be refreshed so that the framework is better able to address the current and future health landscape, which, as we know, is changing and always going to change in the future? What is missing and what needs to be added to the policy framework? Finally, I'd like to reiterate Michael's comments and encourage you all to read the discussion paper and put in your submissions. As he said, they don't have to be fancy. They just need to express your point of view about what we can do to improve and refresh the policy. Your ideas are important to us. We really would love to hear from you. It's the 8th of October is the closing date. If you could jot down a few even dot points, we'd be grateful to hear. Against any of the questions in the consultation document, you don't have to answer all the questions. If there's only a couple that you want to address, that'd be fine. Just, we'd love to hear from you. Thank you.
Thanks, Jan, and calling out health literacy again is one of the themes of interest. Over to you, Elizabeth, to bring us and our guest today an industry perspective on the review.
Thanks, Leanne. Firstly, I'd just like to pay my respects to the Aboriginal and Torres Strait Islanders of the Ngunnawal people, on the land in which I'm standing today, and all our Aboriginal and Torres Strait elders, past, present and emerging, on the lands where you are. I'd also like to acknowledge over 130 attendees, Leanne. That's fantastic and great to see that this, this topic is getting such broad reach. And I hope that that is also lived through those submissions that Jan and Michael are calling for right now. I will keep my remarks brief because I'm really interested seeing a lot of questions coming through in the discussion, but I really just wanted to highlight a couple of things. I think the national medicine policy sets the what framework. What are we trying to achieve? And I think that the really important parts of it are going to be in the how are we going to achieve it? And if you think about timely access, we say timely access as if it's a commonly understood word, but we don't really know what timely access means. And the comments that have come to me that I think are really important to consider is, what does timely access mean? We know that medicines and health services are seen as a cost, not an investment. We know that there are certain elements of the consumers. Oh, don't know what's happened to my video. Oh, you've stopped my video, Leanne, accordingly, but I hope you can still hear me.
We can still hear you. I'm not sure how your video stopped, Liz, but we can.
No, and it says the host has stopped my video, Leanne. So, they.
We can hear
so
you.
I can't start it. How are consumer inputs taken into the assessment of investing in new medicines? What is the consumer's contribution to determining how medicines are valued? What are the system level capacity and capability to take those systems into account? One of the things that has been mentioned is, what is the definition of medicines and how do we expand that definition to include emerging technologies and incredible breakthroughs that we see today, but also those things that we can't even imagine that are going to turn up in the future? How do we make sure that our system capacity and capability is agile enough and flexible enough to adapt to those changes? And accountabilities, I think, are also critical to the discussion. How do we measure when we've got success? When we look at quality use of medicines, and then Jan referenced the PSA, Preventable Harm from Medicines, then clearly we think we've got this fabulous policy talking about quality use of medicines, but can we really truly say we're achieving quality use of medicines if we still have such large numbers of preventable hospitalizations caused by medicines use or misuse? I do like the principles that have been proposed in the discussion paper, but I'd like to suggest that with health literacy has also come an enormous amount of health illiteracy. Misinformation is being delivered in credible ways that people believe, and it's actually expanding health illiteracy and misunderstandings. So how do we counter that? And is the policy going to provide the right framework to be able to do that? It's trust that we need to overcome. The other thing is, how does the National Medicines Policy intersect with the House of Representatives inquiry? But also, many of you will know that Medicines Australia has just signed a new strategic agreement with the Commonwealth Government, where we've tried to also centre on some of those system capacities and capabilities that we think will facilitate the delivery of the National Medicines Policy in terms of modernising our health technology assessment, expanding our understanding of new technologies and funding pathways, and including consumer input into the process of decision making at an earlier point in time. And also, I'm conscious that stewardship should not be seen as a delegation of responsibility. If you make stewardship and therefore the delivery of the National Medicines Policy is everybody's responsibility, who's actually going to be responsible for it and accountable for it? So there needs to be sort of some separation of stewardship and that responsibility. From an industry perspective, we think that we need to develop a thriving and respected industry. And we think that the terms responsible and viable may have served their purpose. But as my colleagues say to me very commonly, and I've worked in intensive care as an intensive care nurse, you can be on life support and be viable. we actually want to encourage an industry that invests in jobs, invests in innovation, and brings these new technologies to Australia. So we actually want a respected and responsible and thriving industry to be a partner in bringing these new technologies to our healthcare system. I'll leave my remarks there, Leanne, and look forward to the questions.
Thanks very much, Liz. And Jenna, our driver, turned your video off just to explain to you and our guests because your connectivity was not great. So we figured we'd trade visibility for being able to clearly hear you. So that was what happened there. Okay, well, look, thanks very much to all of you. It's a really deep and wide area of policy, and you've all touched on different facets of it. We've got lots of questions we received in advance. We've got lots of questions in the box. I might just pick up the first one on something that you touched on, Liz. The review and the National Medicines Policy is a high-level policy document. How does the review fit with some of the other reviews that are underway, such as the House of Reps inquiry into innovative and novel medicines, and the recently announced review, as you mentioned, Liz, as a part of the Medicines Australia agreement with government, the review on HTA methods and processes. What's the specific role of this inquiry and its interface with those? How do you see them working together?
I'll stop my video.
I'm not sure who wants to take that one. Probably one for the review.
Well, from my perspective, from an industry perspective, we see this as a Venn diagram. You know, that patients are in the centre, and where the National Medicines Policy, where the House of Reps inquiry, and where the Independent Review of Health Technology intersect is the piece that will be of most benefit to patients. So, but I'm interested in Jan and Michael's.
So, Leanne, thanks for the question. So, yes, look, this is a busy space. There are always lots of discussions going on around medicines in Australia. As I said right at the start, what the National Medicines Policy provides is that very high-level set of principles which guide everything else that we're doing in this field in Australia. So there will be inquiries. The House of Reps inquiry is focusing on one aspect of medicines, the issue of novel medicines, but the review that we're doing is looking at those high-level principles. So what we hope is that other things, of course, will slot in there. There is also a timing issue here. Some people have asked if we're doing this too quickly. We are keen to do this within the 6-month timeframe that we've allocated, so that then those high-level principles can inform ongoing work which comes out of other inquiries, reviews, and the work that we're all doing together.
Thanks, Michael. Look, we might go to another question, and there's a comment here from Alison. I think that Alison Mark is one of our long-standing consumer representatives, and it segues quite nicely into a question. And she's commented, it would be helpful to have an interactive map that describes the National Medicines Policy and the means by which the various policy aspirations are addressed. There are so many entities that act on the regulation, supply, distribution, prescription, dispensing, administration, and disposal of medicines. It's that Venn diagram issue, isn't it? Really, it's what does the overall landscape look like? I think a map, being a visual person, I think a map like that would be very useful. But to the question, as you can imagine, many of CHF members are interested in providing feedback during the consultation process on some of the specific programs or policies that sit underneath the NMP policy. Is this review able to respond to those issues, or is it out of scope?
Yes, so again, what we're looking at is the high-level principles rather than the specific programs which are running through. But of course, we do expect that people, when they're putting forward their submissions, will be doing it through the lens of what happens beyond the principles and how does this roll out. And so people will be making, I'm sure, comments or recommendations about what may or may not happen. We're planning to try and capture as much of that as we can as well. It won't be part of the review of the National Medicines Policy, but it will assist the Department of Health in preparing for the work which carries on beyond this.
Thanks, Michael. Another question. You've all, I think you commented, I think it was both Jan and Michael, about the fact that the current policy almost has a, refers to consumers in a passive way, using fairly passive language. And we seem to be shifting the language, which I think is really welcome, to the principles of stewardship. So just a question to all of you really about, I mean, that's a term that I don't think is commonplace in plain English. So I'd be just interested in your take on what are we talking about when we talk about stewardship, and particularly, role do you see for consumers and consumer organisations as stewards?
Happy for Jan to go first if she'd like to on that one.
Sure. Thanks, Michael. Yeah, it's a good question. I think stewardship's very important. I guess for me, it relates to the Terms of Reference 5 on governance of the National Medicines Policy. Terms of Reference 5 is about options to improve governance, communications, implementations, including enablers and evaluation. And I think one of the things that I've been very concerned about, I've been working in this area a long time, as most of you know, and one of the things I've been very concerned about is the lack of coordination around what's happening in terms of the various arms of the National Medicines Policy. I see each of the 4 objectives as a sort of arm of the National Medicines Policy. So the access arm and the quality use of medicines arm and the safety and quality arm and the viable pharmaceutical industry, they're all working away in kind of silos at the moment. And there's no sort of overarching sort of, well, from where I sit, sort of way of knowing what each arm's doing to implement the policy. So there's lots of things going on, but what we don't know a lot about it. So stewardship, there's got to be some ideas about governance, I think, that comes through the terms of the submissions. I really love many of you on this webinar to think about governance. For example, when I came into this area many moons ago, there was a lot of projects going on around wise use of medicines because, there were big problems in the community and those problems are still there. And then out of all of that activity that was going on, it was easier in those days. I don't know why it was easier. Maybe we just met more in the Qantas Club or something, but we used to get together and say, oh, this is a real problem and we've got to address it. And so the wonderful Lloyd Sanson just, started APAC, and we fought a lot, but we agreed on a lot of things too. And there were, I was thinking about it recently, there were 6 or 7 big consumer organisations all voicing, their ideas about how medicines policy could be implemented. It was a wonderful, wonderful experience, and it went for many years. So that was a kind of way of, it was big and unwieldy, probably too, although we can do it on Zoom. We've got to be able to bring the stakeholders together to work out what each of us are doing about the problems the policy is going to address, like things like polypharmacy, things like vaccine illiteracy. All of that are big issues for us to address.
Thanks, Jan. So stewardship very much related to governance as well as other issues. Michael, did you have a comment, or Elizabeth?
So stewardship is one of the 5 suggested principles that the advisory group has recommended that people have a look at, and you may like to add other principles that you think are important as well. For me, stewardship is about the privilege and responsibility that we have in managing a resource, and in this case that resource is the medicines which are being made available to the people of our nation. And in order to discharge that responsibility, we need to be doing it in a way where the partnership is working well, where people's voices are respected and are strong, and so it blends in with many of the other areas that we've been talking about today, and particularly that importance of the diversity of consumer voices.
Liz, did you have a thought on that?
Yes, I think I do, but I don't want to suck up the oxygen. Look, the stewardship is critical. I do think so, but I'm also conscious we need to learn from where stewardship is a fantastic ideal, but hasn't necessarily delivered on the outcomes. And I'm thinking in terms of antimicrobial resistance. There are some fantastic guidance documents on antimicrobial resistance stewardship, and yet we're still not necessarily achieving our goals of managing and stewarding the use of antimicrobials. So I think as an ideal, it is a worthy one, but it needs to have guardrails, and it needs to have outcomes, and it needs to have some accountability so we can measure whether we're actually being stewards or whether we're just talking about what stewardship is.
Thanks. Well, I hope that's given some of our audience, particularly our consumers and consumer organisations, a bit of an insight into what that term means from your perspective as a panel, because I think it is an important proposed principle and one to unpack in terms of what it looks like and how it manifests practically in terms of governance and leadership and responsibility for resources, as you say, Michael. There's a lot of questions about measurement and KPIs and impact. The National Medicines Policies, in many ways, a document that works away in the background, setting the framework for a wide range of programs and policies and services and regulation. So it's the services and the policies and the programs that really, well, it's more the programs and the services that actually touch people in their day-to-day lives in terms of medicines access rather than the policy itself. And there was a lot of feedback from the stakeholder forum back in January 2020 that you've all mentioned, where there was a lot of support for a more structured, transparent and accountable evaluation process to inform understanding of the gaps and opportunities, but more importantly, to monitor the delivery of the National Medicines Policy's core objectives. How's the review going to tackle that big challenge? There just seems to us to be a need for an implementation plan and accountability oversight so that we are refreshing perhaps more often or taking into account in a more agile way some of the developments that I'm sure are going to continue to accelerate at an exponential rate. So just accountability and evaluation, comments on that.
Yeah, so thanks, Dan. Again, I come back to what we're setting up here are the high-level principles and the framework for other things to flow. So again, one of the principles that we've suggested is this principle of accountability and transparency, and people might like to reflect on that and provide some examples of where if you agree with that principle, where you see that having an impact in the areas that you're involved with, you're working with, or your members are impacted. So talking about that, we won't be going down into the level of how do we measure individual programs, what are the key performance indicators for individual programs. That's further work which comes later, but it needs to be informed by the set of principles that we'll be working on with you.
Thanks, Michael.
I think though we do need to see from the review some governance structure so that we can see how when that further work is done and KPIs are agreed and different bodies may take responsibilities for certain things, who are they reporting up to? And in the previous iteration, Jan, remember there was a National Medicines Policy Committee and it sort of ended up being disbanded over the years, probably under some deregulation agenda of some kind, but you know, we certainly need some governance structure so that there is a reporting mechanism to be accountable for all of those KPIs as they're developed, I think.
Thanks, Liz. And it's there, and you're canvassing views on that in the consultation paper, you know, from a CHF point of view. And this is a general comment we make about everything at CHF, whether it's the 10-year primary healthcare plan or the, you know, other plans and agendas that are in development, the National Preventative Health Strategy, you know, that an implementation roadmap and an accountability for implementation against those are really, you know, strikes at the issues that matter most for consumers. Michael, this probably is a question for you, and you may or may not be in a position to answer this one. But it's a national medicines policy, and the Commonwealth is leading this clearly, but the states and territories also have a responsibility for medicines funding and regulation, especially through the hospital system. How are they being engaged?
Yes, so absolutely essential that we're engaging with the states and territories as part of our consultation process as well, because as you say, there is some funding and regulation. There's an awful lot of distribution of medicines which occurs out through our states and territories as well. So, yep, again, core partners along with the other groups that we've been talking about this morning.
Thanks, Michael. Now we've got about 39 questions in the chat box here. Some of them around accountability and KPIs and those sorts of issues have been picked up and addressed. I did want to pick up on a question from Penelope about... I
wanted to pick up on the question on the timing. Leanne?
You do that, Liz, and I'll find this other one that I wanted to put to you. So you pick up on that one.
I'm picking up on the timing with the closing date of the 8th of October and an ambitious target of a review in 6 months. And I realise that the review committee are looking at the high level principles, but I do think that as we saw with the House of Reps inquiry, they were able to expand like an elastic band to meet the needs of the community. And I think what I'm seeing in these reiterative questions from the patient groups is that they might need more time, and are you willing to expand to enable that engagement? That's for Michael.
Michael.
Thanks, Liz. So the timeframe has been determined by the Minister, so that's the timeframe that we're working through at the moment. There is a commitment, of course, by this government to deliver the review of the National Medicines Policy within the life of this government, yep. So that's they're the writing instructions which we've been provided with as the review committee.
Thanks, Michael, for that clarification. I just wanted to pick up on a question here from Penelope around, you know, the relationship around the National Medicines Policy and research agenda. She's asking, are there any feedback connections between the National Medicines Policy and research funding priorities through MRFF and the National Health and Medical Research Council? evidence drives the national policy. So how do Australian medicine evidence gaps identified by consumer concerns about access to medicines get relayed into research funding and priorities?
Yeah, it's a great question, and something that's close to my own heart as a researcher as well. With the policy, of course, the National Medicines Policy again is setting the framework, and from that flows what happens in a whole lot of other government programs, including government decisions about where we allocate investments in research. And so it may well be that the recommendations which come through then start to flow. We start to see that flowing through in decisions being made about prioritisation for research activity in Australia. We obviously have two very different but linked large government funded research entities, being the Medicine Research Future Fund and the National Health and Medical Research Council. And each of those initiatives determines, based on national priorities, where we make our targeted investments in research, in health and medical research, which is needed to improve the care and the health and well-being of the people of our nation.
Thanks, Michael. We've spoken about health literacy in the context of needing to build and strengthen it in actions following the adoption of the new policy, but health literacy is so important in terms of people's capacity to engage in these consultation processes that build policies in the first place. So how does the review panel propose to consult with and address those Australians who don't speak English as their first language or at all? There's a comment here that, very conscious that perhaps people on this forum are all educated, technologically comfortable and can use technology. I know, and they're acknowledging, the person asking this question acknowledges it's a really difficult issue to resolve, but equally equitable access to medicines and taking into account the needs of all Australians as the policy's refreshed is very important. So just some thoughts on that.
If I might go first on this one, but I'm sure Jan is going to have contributions to make as well. Absolutely essential that we're hearing the voices of the diversity of people in Australia. And again, lessons that we've learned over the last 18 months with the COVID-19 pandemic have helped to sharpen the focus on why that is so very important. We will be having direct consultations with representative organisations for people from culturally and linguistically diverse backgrounds. For example, FECA, the Federation of Ethnic Communities Council of Australia. I'll be having a direct, the committee will be having a direct one-on-one discussion with. Similarly with Nacho and our Aboriginal and Torres Strait Islander communities, with people with disability, with older people, with people on low incomes. So we are looking at this very wide diversity of stakeholders to provide input into what's important and how this policy needs to continue to develop. So you're exactly right. I'm not sure who asked the question, but you're exactly right. This needs to be a policy for everybody in Australia.
Thanks, Michael. And there's a call out there from Faye Jackson, particularly with regard to, people with ongoing mental health issues and psychosocial disability as well. And making sure we cover off that very important and sometimes very vulnerable sector when it comes to misadventure related to medications. I'm just going.
I'm sorry, Len. I think Jan wants to.
Yeah, look, I just want to thank Michael for his comments, and to say, for me personally, those groups are very important to hear from, because from my understanding of what's happened during the pandemic, sometimes their voices have not been heard, and it's led to unintended consequences, I think. And I think we have to learn from the pandemic in that regard, that particularly those culturally and linguistically diverse communities. And I am so pleased that FEC is going to be talking to us, because I don't see that as the only consultation we're going to be having with them. I see it as the beginning of some understanding of what sorts of problems those communities are having with their medicines. And I think the same with Nacho. We're going to be talking to Nacho, and a very, very fundamental issue for them, and I remember this from APAC, is access, and how, and also, the whole issue of cultural understandings. So I think we're all going to learn a lot on the panel, but also I hope we can refresh the policy in a way that really grapples with the problems those communities are facing. And I think we'll pick up a lot of the mental health issues too, and I think we'll pick up a lot of the not understanding how the system works. I think there's a real issue there too.
Thanks, Jan. Now there's a comment here, and I think it's a nice segue through to the final question I wanted to ask all of you. You might not agree with the comment here, but they're suggesting, Eugene is suggesting, that other than elevating the consumer voice and establishing the important concept of quality use of medicine, what tangible benefits has having a national medicines policy delivered to the country over the last 20 years? I'm not so much asking you as a panelist, a group of panelists today, and Jan and Michael wearing your reviewer's hat, to necessarily cast back and look at the achievements from our current national medicines policy, because the review is all about looking forward. So with that in mind, a last question to all of you, Jan, Liz and Michael. How would you measure success? What would the community see that is different as a result of a refreshed, modernised national medicines policy? What's your aspirations?
Well, much more engagement, I think, for consumers, and certainly that diverse group that we were just talking about. Much more collaboration and engagement with the system, and more trust in the system that it's actually working for them and has their interests at heart. And I think we do have to measure all that. I think there's going to be that terms of reference 5, I think is going to be important in terms of monitoring and evaluation, how we are in fact seeing people more comfortable about asking questions about their treatments, asking questions about their medicines, asking questions about the vaccines, and interacting more with their health professionals. I think that, and as I said, we need to measure that.
Thanks, Jan. Liz, and then we'll give Michael closing remarks.
I think one of the most important things that I hear is that many people don't know there is a national medicines policy. We've got a fantastic bunch of really informed people who are engaging in the review, but for me, a successful national medicines policy is something that people can see, feel, and understand and benefit from, even if when they're well, as well as when they're unwell, and that maybe we need to consider a better job of communicating it and reporting it and measuring the outputs and making that something that we see very visibly and transparently, so that that will build trust in the national medicines policy. If you see it, understand it, and believe in it when you're well, and that it's there as that safety net when you're unwell, and that you see reporting on it to see that Australia is delivering on its very worthy objectives, then that to me will be a success.
Thanks, Liz. And Michael?
Thank you. It's a huge question. Look, it may well be that most people in Australia don't need to know that we have a national medicines policy, but they experience its impact every day through their interactions with our healthcare system, with the services which are being delivered to each individual and to their family. But for me, look, when we look at this in a few years' time, I'd like to see a system where we have greater equity in what happens in Australia. I'd like to see further improvements in the quality uses of medicine. I'd like to see far greater integration with technologies, and particularly what we're seeing with great advances in genomics and that intersection between preventive care and treatment of disease. There's so many areas where the policy will be having an impact. And of course, one of the areas, I'm sure Liz was going to mention this, which has been uncovered during the pandemic, is the importance of having the viable industry in Australia. As we saw when the borders closed and we had problems with access, why it's so important that the industry is very strong here in our country, which of course benefits the people of our country, but also people right across our region of the world as well. But I could probably talk for an hour on that topic, Leanne, but I'm not going to.
No. Thank you. And look, it is a deep topic. It's topical. Medicines really matter to people's lives and their well-beings. That's why it's we've got such great engagement in this topic, I think, on this webinar. So we've got 58 questions that we have worked through some of. I've tried to cluster them together as much as we can. We'll log those and put out some sort of summary answer to those in consultation with the department where we can. Others will be taking as an indication of the sorts of issues. It's a bit of a take the pulse exercise in itself, really, the sorts of questions and comments people put to these sorts of forums. We'll be following those up as key issues as we shape our own CHF submission to the review. So on that note, thanks for your questions. Thanks to the panelists. As I said, when we opened up the webinar today, we really intended this to be a primer. We weren't going to cover all issues in relation to the review. We probably were very ambitious. We never do get to all questions, but that's just time constraints. But we will be answering them and logging them, so be assured of that. But as I said at the outset, this was a primer really to just try and look at, what some of the headline issues are from a consumer perspective for the review. It was very much a primer for our own member consultation. So we'll be running a member consultation, and that will be much more interactive as a feedback session on Wednesday, the 29th of September from 11 till 1. There is a link to that in the chat. If it should be visible to all of you, but we will also send the link if you wanted to register to be part of that interactive session, where we'll be talking to members in more detail and more deeply about the sorts of issues to canvass in our submission to the review at that discussion. And of course, several of our members will be putting in submissions in their own right too, representing their own interests in disease areas. So look, on that note, can I thank you again, Michael and Jan and Liz, for your time. We know you're very busy people, and I hope that's given people a flavour of some of the really headline issues that the review panel are interested in hearing from stakeholders about. So thank you very much and have a great weekend.
Great, thanks.
Thanks, everyone.
Thank you, everybody.
Thanks, everyone.